When we think about hospitals, our minds usually go straight to the doctors and nurses, the life-saving procedures. But behind the scenes, there's this enormous administrative machine chugging along. And today, we're going to talk about the technology that's giving that machine a much-needed digital cure.
I mean, we've all asked ourselves this, right? Whether you're stuck in a waiting room or on hold with the billing department, you can't help but wonder, what's the real holdup here?
Well, it's this. An invisible mountain of paperwork, and I'm talking both physical and digital. It's an endless stream of forms, of repetitive data entry, and a system that's just bogged down. This is the hidden weight on the shoulders of our healthcare professionals. So, just how big of a deal is this paperwork problem? Let's dive in and really take a closer look.
And here's what's so interesting about this. These aren't separate issues. They're all connected. It's like a domino effect. You've got these incredibly skilled professionals spending hours on mind-numbing data entry, all because different systems, say the pharmacy, the lab, and billing, just don't talk to each other. That, of course, leads to staff burnout, and it creates these bottlenecks that we as patients feel directly. It's why appointments take forever to book, or why getting your records is such a hassle.
Okay, so with a problem this massive, where do you even start? The answer isn't asking people to work harder or type faster. It's about bringing in a whole new kind of help, a digital workforce.
And this is it, robotic process automation, or RPA. Now, the name might sound a little intimidating, but the idea behind it is actually pretty simple. We're not talking about physical, walking-around robots. These are software bots. Just think of them as super efficient digital assistants that you can program to handle all those repetitive, rule-based tasks, working away quietly in the background.
And this comparison just lays it all out, plain and simple. A human works a standard day, right? A bot works 24/7, no coffee breaks needed. A person might make a typo. It happens. A bot follows the rules with 100% consistency every single time. It's a workforce that's literally built for speed, scale, and perfect accuracy.
So, what actually happens when you unleash this digital workforce on healthcare's biggest administrative headaches? Well, the results are pretty transformative.
And listen, this isn't some small-scale niche experiment. We're talking about a projected market of over $14 billion. That number tells you just how seriously the healthcare industry is taking this. This is a massive investment because they know it solves some of their biggest operational problems.
Now, this is a really crucial point. This technology is not about replacing people, it's about empowering them. By taking over the tedious, soul-crushing tasks, RPA frees up our amazing nurses and doctors to focus on what they were actually trained to do: take care of patients. It's a direct antidote to that administrative burnout we were just talking about.
And as a patient, you feel this difference almost immediately. The check-in process gets smoother, appointments are scheduled way faster, and your billing info is suddenly more accurate and easier to get. But the best part? It means more actual face-to-face time with your doctor and way less time wrestling with a clipboard and a pen. And for the hospitals themselves, the benefits are crystal clear. You're talking about lower operational costs, way fewer expensive billing mistakes, and a perfect automated audit trail that makes compliance so much easier. It really is a win-win-win.
Okay, so this all sounds great in theory, but what does it actually look like in the real world? Let's get into some concrete examples of RPA in action.
Let's take appointment scheduling. A bot gets your request, instantly scans all the doctor's calendars, finds the perfect spot, books it, and even sends you a reminder. But here's the really slick part. If someone else cancels, the bot automatically offers that newly open slot to the next person on the waitlist. It's so dynamic and efficient, and it keeps the whole system flowing.
And it doesn't stop there. RPA can be used to catch billing errors before they even happen by checking claims against insurance rules. It can act as a digital bridge between all those siloed data systems to create one single unified patient record. And it can automate those audit logs, which makes proven compliance a total breeze. It's a true multi-tool for healthcare's biggest operational headaches.
But as powerful as all this is, believe it or not, it's really just the beginning. The real game changer is what comes next when we start moving from simple automation to truly smarter systems.
So here's the key idea to hang on to. RPA is fantastic at doing tasks. It follows rules perfectly. But when you combine it with artificial intelligence, your systems can actually start to think.
This quote really nails it. You're moving beyond just automating what a human does today, and you're starting to use data to predict what should happen next. This is the leap from reactive care to truly proactive care.
I mean, just imagine a system that can predict which patients are at high risk for a certain condition and then automatically schedule the necessary follow-up care. Or one that can manage the health of an entire community by spotting trends in the data and coordinating outreach efforts. We're talking about building a healthcare system that anticipates our needs before they ever become emergencies.
And that, right there, is the real promise in all of this. By letting the bots master the routine, we're not just building a more efficient system, we're finally freeing up our best and brightest minds to focus on what humans do best: innovation, compassion, and, just maybe, finding the cures of tomorrow.